نعم دكتور نسمع.
السلام عليكم شباب، موجودين؟
وعليكم السلام ورحمة الله دكتور، موجودين.
I am Dr. Haidar Jamil Makki. Today we have the second lecture of the second semester. Our lecture today about the imaging of the urinary system. Imaging play very important role in the diagnosis and management of urologic disease. الحقيقة يعني حتى أكثر من باقي الاختصاصات. Why? Because many urologic conditions are unable to be assessed by physical examination alone. Whatever you do in physical examination, you might not reach the final diagnosis without the use of radiography. So radiology has been long critical to the diagnosis of condition related to the kidney, ureter, and the bladder. Our outline of this lecture today, I mean, what we talk today? What is the imaging modality used in urology? We will start from the most simple technique to the most, and ascending to the most advanced and sophisticated technique. What are these techniques? First of all is the plain film of abdomen. Second, we will talk about the excretory urography. Third, we will talk about what we call it collectively retrograde study. Retrograde study include retrograde byelogram, retrograde cystogram, retrograde urethrogram. Fourth, we will talk about ultrasound, then about computed tomography, and then about magnetic resonance imaging, and lastly, we will take short notes about the radioisotope study. Okay? Any question till now? First of all is the plain radiography. The plain radiography نقصد بها هاي الأشعة السوداء العادية اللي كلكم أنتم شايفين. The plain radiography in urology, what is the aim? If you know reading plain radiography, intend as urologist to display what? Display the kidney, display the ureter, and display the bladder. This is our organ. And so سمعوني مرة ثانية شباب؟
نسمع دكتور نسمع.
So what is the technique of in doing KUB film? The patient should be in supine position and the view of the film. احنا نقدر نحدد الفيو
دكتور عرض
from the level of
عفوا العرض
from the level. نعم
دكتور السلايد شير ماكو.
سلايد شير ماكو. موجود سلايد شير. كلكم شباب سلايد شير ماكو؟
اي حتى احنا ماكو دكتور.
يطلع جاي تشوفون سلايد شير شباب لو بعد
بعد
ليش؟ اوكي now
دكتور ايه هسه واضح.
هسه واضح تمام. We return back to the technique of KUB film, the patient in supine position, and in order to make a proper KUB film, it should be the level from the level of the diaphragm to the level of the inferior pubic symphysis. Why is that? Because the kidney is essentially below the diaphragm. So if we attempt to the kidney, it should be included below the level of the diaphragm. And also, why the view at the level of the inferior pubic symphysis? Because also the same problem, because we tend to display the bladder, and the bladder is essentially above the level of the inferior pubic symphysis. And we will see here. This is, in this picture, it is a proper KUB film. Why? Because the inferior pubic symphysis can be seen and apparent in the view. You can see here. And the level of the diaphragm, which is usually above the first lumbar vertebrae, also is above here. In this view, we can see here a radio opacity at the right hypochondrium. And please, if you have كل واحد إذا عنده ممكن قلم وورقة حتى يكتب فد ملاحظات بسيطة. Now there is a radio opacity at the right hypochondrium. What is the differential diagnosis of this radio opacity? It is either a renal stone, or another differential diagnosis is a gallbladder stone. How to differentiate between these two problems? Okay, while if there is a radio opacity on the left side, so there is no gallbladder on the left side, so we will be sure that this is a renal stone. In this picture also, we can see here this structure. It is a urethric stent. In urology, we widely use stent.
ما اسمع.
Sorry, شنو اسف؟
الصوت يقطع دكتور.
لا دكتور الصوت واضح.
هذا من يمك المشكلة عاشتيش. بالurology, widely use a stent, different type of stent, use drains, using catheter. So what is the proper way to diagnose the stent is present? What is the proper way to diagnose this stent in its proper site? It is by simple KUB. Here is a urethric stent. Please name it. كتبوها ملاحظة. Commonly, we call it a double J stent. Why double J? Because هنا لازم هو منها double مثل حرف الجي مو جي، ولو هنا صار مثل الجي، لكن هو لازم جي فوق وجي جوا فيسموه double J stent، أو اسم الثاني urethric stent. Another شوفوا هذا السهم مؤشر على there is a line. This is the two line. One line represents the stent, and beside the stent and in contact to the stent, there is another radio opacity. واحمو this is also a renal stone. In this KUB film, شفنا ثلاث شغلات، شفنا radio opacity، شفنا stent. So what is the indication in doing KUB? First indication in the anticipation of contrast study. بعدين راح نشوف ندرس على ناخذ اليوروغرافي. Before we have any contrast study, we should do a KUB film. Why? Because sometime we missed a pathology if we use a dye. مثلا إذا كان عندنا stone, high radio opaque stone, and we use a contrast. The contrast لونها أبيض، والستون لون مالتها أبيض، فراح تضيع علينا. We should before any contrast study use a KUB film. واضحة؟ Second indication for the KUB is the diagnosis of renal calculus. Renal stone can be diagnosed by KUB, and just like that. This is radio opacity. This is here radio opacity. Third indication, we talked to you before, assess position of drains and the stent. This is drain. All of the drain are radio opaque, by the way. كل الدرين صناعيا مصنعة هي radio opaque. كل catheters are radio opaque. Seen can be seen by KUB. لكن إذا إحنا رأسا سوينا contrast study without KUB film, this drains, this radio opacity may be missed. So KUB, in the first indication of it, is before doing contrast study. واضح مو؟ أي سؤال حد هسه؟
يعني دكتور بالكونتراست ستدي ما راح تبين، بينما راح نسوي اليو كي بي راح تبين.
بالضبط، هي لون هسه ستنت هذا شنو لونه؟ لونه وايت، واضح. بالكونتراست بعدين راح نشوف هم نفس اللون، فاذا ما سوينا هاي الستدي مرات تضيع علينا وي ميس ات. الستنت may be big enough to be not missed, but a small stone missed should be done KUB before any use of contrast.
دكتور هذا شنو هذا كنا خيط بالابيض بالاشعه مبين؟
اي هذا حكينا عنه، هذا يوريتريك ستنت، هذا ستنت يوصل بين المثانه الى الكدني، هذا وايدلي يوز باليورولوجي، مو وقتها هسه نحكي عليه، بس هذا يسمونه يوريتريك ستنت، وانذر نيم له دبل جي. هاي ملاحظات بسيطة، إذا عندكم ورقة وقلم ممكن تكتبوها على جانب. تمام. This picture also show a KUB film. Why KUB film? Because the inferior pubic ramus is apparent here, and the first lumbar vertebrae is apparent here. Above it is the diaphragm. In this picture, we can see the transverse process of the spine. Easily seen, transverse process of the spine. And along this transfer process, there is radio-opaque shadow, which is correspond to the normal anatomical course of the ureter. The ureter pass along the transverse process of the spine. So it's most likely to be a ureter stone. This is another KUB film. KUB film, the inferior pubic ramus is apparent here also. And here we show a large calcified radio-opaque shadow at the level of the bladder, so it is mostly a bladder stone, obviously. What is the limitation of the use of KUB film? We know the indication. So what is the limitation? First of all, that overlying stools and bowel gas may obscure small stones. So in order to do a proper KUB film, we should prepare the patient. How to prepare it? We ask the patient to fast before doing the study. By fasting, we avoid gases as much as possible. And ask the patient also to pass a stool before doing the study. And this, how can we prepare the patient for a study in order to avoid problem? Second limitation in use of a plain film, that some stones are found on the bone, like I will send back to the previous slide. If there is a stone here located, so the stone, it may be overlying this, the pelvic bone, so it may be missed because the same overlap between the radio opacity of the bone and between the radio opacity of the stone itself، خصوصا إذا كانت الstone small size not will be apparent. واضحة الفكرة مو؟ إذا أي سؤال أنا حاضر. Third limitation to the plain film, although the most important use of KUB film in the diagnosis of renal stone, but you know that not all the stone are radio-opaque. Some of the stone, 10 to 15%, and please write it, 10 to 15% of the stones are radiolucent, and this may be missed by simple KUB film. أتمنى تكتبون هاي الملاحظات. Radiolucent, how many the percentage of radiolucent stones is 10 to 15%.
دكتور الأشعة كلها مأخوذة من القلب؟
نعم.
الأشعة كلها من القلب؟ بوستيريور ناخذها؟
بوستيريور شنو؟ ماكو بوستيريور، ما قلنا اكو شيء بوستيريور. شنو قصدك؟
ما موضحها بالصور اللي أخذناها هسه كلها تقريبا الأشعة كلها من القلب مو؟
والله ما جاي افهم شنو تقول. اذا ممكن تكتب لي كتابه حتى احكي لك اياها. هسه هاي الاشعه لا بوستيريور، هاي اي بي فيو، مو مهم الفيو بالنسبه لي، هو اي بي فيو، يعني ماخذ البيشنت فروم سوباين بوزيشن وناخذ له صوره. فهسه مو مشكله الفيو شو ما تقدر، بس ما نقوله، ما نسميه بوستيريور، بس انا اي بي فيو. Okay, this is we talk about KUB film. Any question? The second imaging study is the intravenous urography, or some call it intravenous pyelography. It is the same. IVU or IVP is the same. It is an X-ray film, but by using of contrast media solution. It is a solution injected intravenously by cannula, and multiple plain film taken later at regular interval. So we should know what is the contrast. بالحقيقة, there is no Arabic translation for the word contrast, but by definition, it is a substance used to increase the density of structure or fluid within the body. يعني هو مادة سائلة نحقنها بالبody. When the body take it, it will increase the density of that structure. There is a lot of material have this characteristic, contrast characteristic, but iodine is the most common element in general use, not only in urology, but in the whole medicine. as an intravascular radiological contrast medium. يعني احنا نستخدمه بالجي اي تي، يستخدموه حتى القسطره جماعه قسطره القلب. الكونتراست all is iodine يسمونه iodinated contrast. ف it is the same. Contrast agent is iodinated contrast. What is the important limitation to the use of contrast? نقدر دائما نستخدم الكونتراست في كل الاحوال؟ لا طبعا. There is limitation. The contrast when injected intravenously, the blood taken it, and then it is excreted exclusively from the kidneys. So if the patient have poor renal function, this contrast material will be accumulated in the kidney and exert a very bad toxicity on the kidneys. So the patient should have a good renal function in order to use contrast. This is the first limitation. Second, if the patient have a history of allergy to the contrast, we should avoid use it. And this is not uncommon. This is really not common, but not uncommon. This is true problem. We made us cannot use a contrast. واضحة الفكرة؟
هذا دكتور.
How it is the technique? How we can do an IVB? First of all, as we said before, a plain image, or what we call it a preliminary plain film. عرفنا ليش نسوي plain image? In order not to miss certain pathology by the contrast. يعني حتى الكونتراست لا يضيعنا في certain pathology. We do a plain film, first of all. Then contrast media injected intravenously. And then multiple X-ray film taken at timed interval. First at 1 minute, then at 5 minutes, then another picture at between 10 to 20 minutes, and then lastly, we take what we call it a delay film. Delay film more than 1 hour. As we call it, not exact time, but we call it in general delay film. Lastly, before we finish the study, we ask the patient to void, urinate, and return back taking a last picture. If we do this, we do a proper IVB study. Here we have two pictures. We will talk about them. First one, on the right side, we can see an IVB study. Here the contrast, the soft tissue density of the kidney is more apparent than that of the KUB. يعني بالKUB ما نقدر احنا نشوف الكدني بهذا الوضوح. Why? Because the kidney is taking the contrast medium from the blood and by the cortex and excreted. So the kidney here is more dense than in the KUB film. Then the contrast is excreted in the renal pelvis. Then from the renal pelvis to the ureter. The ureter here can pass along the transverse process and then ending to the bladder. One important note, ملاحظة مهمة, the whole ureter, not the ureter, not the whole ureter apparent in the picture. Why? يعني هنا اليورتر مو كله مبين وهنا اليورتر مو كله مبين. And that is the normal. Why? Because the ureter have a peristaltic activity. So the peristaltic segment not appear in the picture. فهاي واضح تصير عندكم واضحة. The ureter أجزاء من عنده تبين لكن أجزاء ثانية ما تبين. This is the normal. This is the normal. In this picture for another patient هذا مريض ثاني ونفس الأول, we can see on the right side or the right kidney also the soft tissue density of the kidney is well apparent. Here the minor calyx, major calyx. Here the renal pelvis, and here the ureter. Also, not the whole ureter is apparent, and here the normal bladder. While on the left side, here the renal pelvis is little bit dilated. The diameter of the renal pelvis clearly is little bit dilated. And the whole ureter is apparent. يعني كل الحالة هنا كل اليوريتر مبين بهذا الستدي, which is not normal. Mean that the ureter is dilated. And obviously here the diameter of this ureter is larger than the diameter of the other side. واضحة مو؟
دكتور العفو, بس بالنسبة لهذا اليوريتر ما يكون واضح بهذه المنطقة ليش؟
اليوريتر هذا بريستاتيك اكتيفيتي, ده نورمال يوريتر. اليوريتر الطبيعي بريستاتيك اكتيفيتي.
شو المقصود بريستاتيك؟
فإذا بريستاتيك سيجمنت ما راح تبقى بيها الصبغة, الكونتراست ما راح يبقى بيها, فما راح تبين بالايمج. واضح؟
دكتور بس البريستالتيك أكتيفيتي إيش تقصد بيها؟
شلون يعني؟
البريستالتيك أكتيفيتي إيش تقصد بيها؟ يعني بالعربي.
الأمعاء ما تتحرك بطريقة البريستالسيس. اليورتر عنده نفس الخاصية peristaltic activity، يعني يتقلص وينبسط حتى يدفع اليورين من above toward downward. هاي يمكن بعدين نحكيها لكم في محاضرة أخرى. بس البريستالتيك activity هي to push something، يعني انت الانتستين have peristaltic activity in order to push the feces. اليوريتر هم ايضا عنده peristaltic activity in order to push the urine. فبريستالتيك يتقلص وينبسط. بريستالتيك اكتيفيتي هي تقلص وانبساط في انهالو ستراكشر. تمام
واضح. شكرا.
واضح. Here another normal IVP taking 5 minutes after the procedure. Here clearly the anatomy of the collecting system is apparent in this picture. Here the density of the kidney is apparent more than ما نشوف احنا هيك density بالكيوبي العادية. Then here minor calyx, here the major calyx, renal pelvis, and then to the ureter. This is a normal. IVP contrast تعطينا فكرة very excellent about the anatomy. Here the renal papilla، هذا المكان يسموه renal papilla اللي هي drain be the collecting duct. بعدين نعرف شنو collecting duct. تصب هنا و the renal papilla، بعدين تروح على الماينر كاليكس، بعدين كل 2 أو 3 ماينر كاليكس يلتقون يسوون الميجر كاليكس، والميجر كاليكس يصب بالرينال pelvis and then to the ureter. Okay. Here another normal IVP. Here the patient also we can see the density of the kidney. We call it الاسم هذا طبعا اسمه نفروجرام كيس، مو مهم بس تعرفونه يعني بس السمعة دي. And this is then the renal pelvis. Here the ureter. Ureter is not apparent، يعني اكو اجزاء من ureter مبينه لكن اكو اجزاء اخرى ما مبينه which is a normal. And here the bladder. The bladder here is partially full. بعدنا في بداية الستدي فpartially full. In the second picture after how many minutes I don't know, but the bladder can see distended with the contrast, while the contrast disappear from the kidneys, disappear from the ureter. We call it wash out from the kidney. And the last picture we told you before finishing the study, we asked the patient to urinate, and this patient obviously urinated, and this is a post-voiding film. What is the indication of IVU? First of all is the evaluation of ureteric obstruction, what is congenital or acquired. Yani if there is obstruction to the ureter or to the kidney, the contrast doesn't descend, doesn't pass. That's obvious. So this can help in the diagnosis of ureteral obstruction. Second indication, when to use IVP, is surveillance for tumor within the urinary tract, which appear as a filling defect. يعني إذا كان التيومر pelvis within the ureter, within the bladder, will appear as a filling defect. And in this picture, I will show you what I mean filling defect. It means a black hole surrounded by the contrast. This is obvious here. This is a filling defect. What is the differential diagnosis if we see a filling defect? What is the diagnosis of filling defect? عندنا 3 احتمالات، يا either renal tumor or radiolucent خطين تحت radiolucent, and third blood clot, sometimes blood clot in the urinary tract appear also as a filling defect. This picture is very obvious filling defect in the bladder. Third indication for the of trauma or injury to the collecting ureter. The contrast, if there is injury to the urinary tract, the contrast will be leaking. The contrast will inside the urinary tract. We call it extravasated out of the urinary tract. So that's indicate there is an injury. If the urine is extravasated around or leaking the contrast around the kidney, there is injury to the renal pelvis, for example. If there is the contrast extravasated around the ureter, so there is an injury to the ureter. If the contrast extravasated around the bladder, so from into the blood. One of the use of IBU is an anomaly. Sometimes patients, individual have double ureter or double anomaly in general, double ureter, double pelvis, double kidneys, because the IVU is very well in delineating the anatomy of the collecting system. اوكي واضحه سؤال حدث
دكتور بس آخر نقطة، بس آخر شيء ممكن تعيدين الصوت كان يقطع.
النقطه الرابعه اللي هي الانديكيشن اوف IVU indicated in the anomaly يعني there is anomaly in the anatomy. Some individual have مثلا, for example, there is a lot of anomaly, but double ureter. Double ureter will be aberrant on IVU. If we need to use imaging study to diagnose ureteric anatomy or collecting anatomy, طبعا الكيو بي ما راح يطلعها، ما يطلع anatomy، لكن contrast material will be very well in delineating the anatomy. So in cases of double ureter, ناس عندهم double kidney, double collecting system, very helpful ال IVU study in diagnosis these anomaly. واضح؟
واضح شكرا.
Another imaging modality used in radiology is what we call it collectively. نسميها retrograde. Why retrograde? Retrograde because we use a special catheter, inserted it through the female, through the urethra. And this is, first of them is the retrograde bilography. This is the catheter. This is a KUB film. Catheter, special stent or catheter introduced to the kidney. And later on we push a contrast, the same contrast, نفس المادة اللي نستخدمها intravenously نستخدمها push it through the catheter. If our aim to delineate the kidney and the ureter, we call it retrograde bilography. If our catheter only in the bladder and our aim is to delineate the bladder, we call it retrograde cystography. If the catheter only in the urethra, we will see later. If the catheter only in the urethra, so we call it retrograde urethrography. Fine? What is the indication? طبعا important note, it is an invasive. يعني هذا من تخلي catheter انت بهاي الطريقة, so it is invasive. Sometimes need even general anesthesia. So nowadays, it's very rarely used retrograde biology in the presence of advanced imaging technique. But what is in general the indication of this retrograde study? To evaluate collecting system in patients with hematuria. If there is finding on IVP or ultrasound or CT not clear and you need more confirmation, so you can use it. And lastly, and most important, when the patient have poor renal excretion, so and we need to do a contrast study, so it is better to push the contrast directly through the catheter rather than give it intravenously. واضحة؟ ماشي. The contraindication for this study, retrograde study in general, is the urinary tract infection. Any urinary tract infection is contraindicated for retrograde study because we augment this infection. Another retrograde study. Here, cystography. Why cystography? You can see here the line, it is a catheter. This catheter reaching only the bladder, and it is well, the dye is pushed in the bladder, and the bladder well delineated. What is the indication of cystography? Usually use it in the absence of another imaging technique for diagnosis of a bladder injury or trauma. كتبوها إذا عندكم في الملاحظة. Also, we can use it for diagnosis of other bladder pathology, as I said, in absence of other technique. يعني إذا ما عندنا other technique, it is nice to be used and easily. تمام؟ Last retrograde study is retrograde urethrography. Here, the catheter at the tip of the penis, not aberrant here, but the catheter here, and the dye, it is the same, the contrast material, pushed through the urethra. Here, a normal caliber, يعني wide urethra, homogeneous, so it is a normal urethra. What is the indication of urethrography? This is for the diagnosis of urethral pathology, mainly urethral structure. If there is structure, you can see a narrowing here or anywhere. Okay, that is this is a picture of urethroplasty. Go. أي سؤال حدثه؟ تمام.
دكتور بس اليوريثروجرافي يا إما نستخدمها؟
For diagnosis of urethral pathology, mainly urethral structure. Urethral structure. تمام. Another imaging modality used commonly widely in urology is the ultrasound or ultrasonography. Is very fundamental to the practice of urology. Indeed, urologists may be more familiar with ultrasound than other clinical aspects of medicine. Ultrasonography has a special criteria. It is non-expensive, usually cheap, non-invasive, and it is a safe. Has no ionizing radiation, so it is safe. What is the principle? Short note about how the ultrasound work from this picture. It is depend on electrical current. Electrical current passes through the probe, and here a special type of a crystal converted this electrical current to a sound wave. Sound wave goes and hitting the tissue and return back in different intensity. Intensity تعتمد على intensity of the tissue and return back to the crystal. The crystal, again, converting this sound wave to electrical current, and this electrical current goes to a special software, converted it to a picture or image. This is picture for demonstration of an ultrasound. This kidney. Here, the black area is the cortex of the kidney. Here, this is the diameter of the kidney. This is the longitudinal diameter, and number 2 is the transfer diameter. The white area, we call it the sinus, and here apparent renal cyst. It's simple renal cyst. Why? Because it is homogeneous, black color with a soft outline. It is a simple renal cyst related to a kidney. It is for demonstration. Assessment of renal cysts and masses. We can easily diagnose renal cysts and masses by use of ultrasound, not give us the whole characteristic of the masses, but it can help in the assessment of these masses. Second, in the assessment of dilated upper urinary tract. The urinary tract, if it is dilated, that means there is a pathology. There is a disease. So this dilatation is easily diagnosed by ultrasound. Third and most important, diagnosis of renal stone. Almost all stone can be diagnosed by ultrasound. Fourth, percutaneous access to the renal collecting system. A lot of a procedure through the skin done to the collecting system. I mean to the renal pelvis or to the bladder. بمساعدة الالتراساوند, this procedure will be very safe. يعني الالتراساوند will show us our way to interfere with this procedure or to do this procedure. So by the aid of ultrasound, we can do percutaneous procedure easily. Fifth, diagnosis of bladder pathology. Etc. Any type of bladder pathology can be easily diagnosed by ultrasound. Sixth, assessment of prostate size and morphology. Although we can assess the prostate size, but of course, ultrasound cannot say what is its benign or malignant. This is for histopathology, but it's very helpful in the assessment of prostate size and morphology. Lastly, ultrasound also have a role in the assessment, not diagnosis, final diagnosis. How is that? In a trauma patient, ultrasound can see fluid surrounded the bladder or the kidney. So it give us an idea about the presence of a trauma. Not a final diagnosis, but very helpful in the assessment of trauma patients. Okay, any question about the ultrasound? Thank you. Computer, another imaging and advanced technique in urology, widely used in urology, and indeed it is the standard technique in urology, is the computed tomography. How on the base يعني معتمد على الاكس راي ترانسميشن وقطعه ان هاي القطعتين تدور بسرعه حول المريض ترسل اكس راي سلايسز يعني كل 5 ملم كل 1 ملم depend on the type of the machine itself. And this detector transmits the X-ray beam to a computer, and this computer by special software this slides to an image. So this is for your CT either used alone or with the aid of contrast, and this is called CT urogram. If we use contrast with a CT, we call it CT urogram. CT urogram replace any other imaging modality, especially IVU, and become the imaging in modern urology. What is the indication of CT? In CT can work up for hematuria. For hematuria, whatever the cause of hematuria, CT can diagnose it most of the times. By CT with contrast. The most sensitive for diagnosis of kidney stone, although we said kidney stone that can be diagnosed, CT. Unless assessment and diagnosis of trauma can be done easily with CT. This is CT picture for the same patient here, but multiple level. This is the liver here, and here the same patient, but we descend in liver is the same for the same patient and liver. This is different level at the الكونتراست يعطينا ديلاينيشن للكدني بطريقه كلش واضحه وبسيطه. At the same patient, when we descend more, we can see here the kidney also, another part of the kidney. Letter A refer aorta, here the aorta. V refer to the renal vein. شوفوا هذا vein طالع.
دكتور الصوت كلش يقطع استوقف شوي ما سمعنا بهالسلايد.
اسف ما اعرف عندكم كلكم صوتكم يقطع، صوت يقطع لو بس انت؟
اي دكتور كل احنا
لكن التعليقات من السلايد القليل هذا تقريبا كلش يقطع واصلا يروح ويجي ورا شوي.
اوه صوتي جاي. I'm sorry يعني this is not يعني بالكلية هذا not problem ما أعرف شلون أحلها بصراحة. Okay, I will go. Any question later on I can talk again. Any slide you missed I can later on. This is also a CT scan, but this is call it axial view. In CT there is axial view, there is coronal view. You can choose the view. In this view for the same patient, this is the kidneys. When another level of the kidney, we can see here a large mass. This is the kidney, and this is a large mass related to the kidney. And this mass has irregular outline, and this is the characteristics of malignant mass. Malignant mass has irregular outline, while if it's a simple cyst, this will be sharp, simple outline. Irregular outline. So CT can easily give us the characteristic of the renal mass. This is another picture for CT, both for the same patient, but depend on opinion of radiologists. If we intend to see the kidneys, this is the picture. And here, in this picture, intended to see only the collecting system. We mean the calyx, the renal pelvis, the ureter, and the bladder. It's just a software technique that makes the difference between the two. We can choose either of them. For every imaging study, there is a limitation and disadvantage. In the CT, the most important disadvantage is the radiation exposure, high radiation, more than any other study, to the patient and even to the urologist or radiologist. So because of this high radiation, in general, CT is contraindicated in pregnancy. Another limitation is related to the use of contrast. We said before that contrast cannot be used in renal function or patient have allergy to the contrast. رجع الصوت واضح؟ شباب الصوت واضح؟
نعم دكتور واضح.
تمام. اكو سؤال على السي تي. المهم عرفتوا امتى what is the indication of use of CT and what is the disadvantage of CT. واضحة عندكم؟ تمام. ماكو شيء يعني واضح. Another advanced imaging technique is the magnetic resonance imaging. Significant advantage to the MRI is the excellent contrast resolution of soft tissue without the need for contrast. يعني بدون contrast, the MRI can give us an excellent contrast resolution of soft tissue. So currently MRI in general بصورة عامة يمكن نستخدمها when the patient cannot be given iodinated contrast. فهذا الأفضلية للMRI على CT and if we cannot use a contrast. So when the MRI is indicated, first of all, in the evaluation of renal mass, cystic and solid, have high sensitivity in the diagnosis, just like the CT scan. Second, staging of renal malignancy. What I mean by staging, it is MRI can nicely diagnose metastasis of renal tumors, so it will help in the staging of renal tumors. Third, evaluation of venous structure. Fourth, and most important, it's very nice in characterization of adrenal pathology. MRI is an imaging modality preferred over CT scan in patient with a history of contrast allergy. I said that before, and in patient with compromised renal function. But also, it have a limitation in its use. The most important limitation is the cost. The MRI costly, and there is another limitation is the closed space phobia in some patient, because we put the patient in a tunnel-like structure. This is a picture for an MRI for demonstration only. It is an axial view. Here you can see the kidneys, obviously. This is for demonstration. Last, sorry.
دكتور هو ممكن يستخدمون ويا الايودين مو؟ يعني مرة حالة شديدة عادي يستخدموها.
لا الكونتراست ايودين ما يستخدم ويا الMRI.
هو دكتور مو نفس الرنين؟
اي نفس الرنين.
اي عادي مرة انا استخدمته يعني وحطوا لي كانونه وشأكدوا لي على مود.
ما يستخدمون الكونتراست، يستخدمون مادة أخرى حتى اسمها يعني اسم الموداليتي. نعم. لا مو
غير الايودين.
لا مو ايودين، مادة أخرى. مو يعني مو موضوعنا هذه، بس هم ما يستخدمون الكونتراست، ما يستخدمون الايودين. تمام؟ هاي most important أصلاً most important difference between MRI and the CT. تمام؟
تمام دكتور.
Last imaging and the most advanced imaging technique in modern urology is the nuclear scintigraphy. Radionuclide imaging is the procedure of choice, is the best procedure in the evaluation and diagnosis of obstruction and function. كل الimaging study before cannot give us an exact idea about the function of the kidney. rough يعني يعطينا بشكل عام لكن exact idea about the function of the kidney cannot be given but only with the nuclear scintigraphy. So the method of choice in the diagnosis of obstruction and function is by nuclear scintigraphy. By nuclear scintigraphy, there is no contrast agent are used مثل MRI, so it does not damage the kidney. Has no toxicity. Also, to result in minimum absorbed radiation, not like the CT. There is high radiation in CT, while in nuclear scintigraphy, it's mostly safe. And also, it is free of allergic reaction. There is no contrast used, so there is no allergic reaction. Renal scintigraphy also, it is non-invasive, has minimal risk. The only limitation for the use of nuclear scintigraphy is the cost. It is very high cost and the availability. It's not available all the time. بالحقيقة احنا في البصرة يمكن توفرت في آخر سنتين كلش مو كل الأماكن موجود بها nuclear scintigraphy. How it is the mechanism of how they do a nuclear scintigraphy? A radioisotope agent in a solution هو محلول radioisotope agent injected intravenously, and then a special type of camera يسموها gamma camera measure the radiation emitted from the radioisotope, and the digital measure the radiation, and digital workstation محطة خارجية تجمع هاي الصور, gather it, processes it, and display the information as in the picture shown before. Here the picture of nuclear scintigraphy, and here they analyze it. This is only for demonstration. It's important for you. Last slide. We know what is the important in nuclear scintigraphy. We have it 3 radioisotope agent in urology. Radioisotope why and why? Like in urology we use commonly 3 types. First of all, big name أنا ما مطلوب من عندكم, just we name it technetium diethylene trimethylene, مختصرا نسميه DITBA, primarily excreted through the glomerular filtration, so it is an excellent in the diagnosis of obstruction and renal function. يعني just remember the name DITBA and the diagnosis of obstruction and renal function. Second radioisotope study is summarize the technetium dimercaptosuccinic acid, summarize it as DIMSA. It is the best imaging study in the measurement of renal function and GFR. Last radioisotope type we use in urology, مختصرا نسميه MAG3, summarize the big name, mercaptoacetyl triglycerine. Just remember MAG3. It is the excellent imaging of choice in the diagnosis of obstruction in the urinary tract. It is most sensitive, even more sensitive than CT, MRI, and ultrasound. Thank you. Any question?
عفوا دكتور, بس سلايد 23 إذا تقدر تعيده لأن كان الصوت كلش يقطع يمك وما يعني سمعنا.
يا سلايد يا رقم؟
سلايد 23.
23. اي كمبيوتر توموغرافي. احنا هنا انا المهم انتم البرنسبل اوف اكشن اوف سي تي just for demonstration it is to have 2 parts. السي تي هاي الحلقه الموجوده حول المريض have 2 parts. One emitted X-ray and second is detect this transmission. They send a lot of thousands of X-ray on thin slices of the body, and there is computer analyze this transmission. It is just for your knowledge. But what is the most important for you to know, الشيء المهم اللي انتم لازم تعرفونه, that the CT can be used with IV contrast, and CT we name it CT urogram. And this CT urogram nowadays بهذه الأيام replace any other modality, especially the IVU, and become the imaging modality of choice in modern urology. Why? Because it can be easily diagnosed most of urological disease. For example, the indication workup of hematuria. What we mean by workup, we look for the cause of hematuria. By CT mostly can give us the cause of hematuria. Secondly, for urologic malignancy, CT urogram can almost diagnose all types of urinary malignancy. Third is the detection of a kidney stone. Kidney stone, we said before, can be diagnosed by KUB, by ultrasound, but the CT is the most sensitive method for diagnosis and detection of kidney stone. Lastly, in the assessment of a trauma patient and diagnose type, site of trauma, give us details of trauma to the urinary tract. Okay?
دكتور إذا ممكن سلايد 21 توضح الصورة مالته.
كان الصوت ما واضح 21
يعني ما سمعته.
هذه for demonstration only. This picture for demonstration only. Show the kidney in ultrasound. This is the kidney. هذا البلاك area هي الكورتكس of the kidney. احنا نريد نراويكم شلون تبين بالسونار. وهذا المنطقة اللي بالنص اللي هي الساينس اللي تشمل قصدنا البلفس. وهذا renal cyst بالكدني related to renal. سامعين ب simple renal cyst related to the kidney only for demonstration. Another question? Any other question? أي واحد عنده سؤال ب small group we can discuss it later. I hope you enjoy the lecture. Really, I hope you enjoy it. Thank you. 10 minutes and we will meet again in the small group discussion. Thank you.